our special guest, Dr. Mary Smith, to discuss her report regarding the condition emphysema. She is one of the world's leading pulmonary disease specialists and has been studying the effects of emphysema for 12 years.
Hi Sarah. So my main goal when researching emphysema was to give the public the necessary information to prevent this disease.
So Dr. Smith, can you explain to us what emphysema is?
Yeah, emphysema is a chronic obstructive pulmonary lung disease that is caused by the degradation of elastic fibers and the apoptosis of alveoli containing the alveoli cells are small structures in the lungs that enable the highly efficient exchange of gas and the damaging of these walls, which causes large areas of the lungs to become non-functional, significantly reducing the effectiveness.
And what symptoms is an individual likely to experience as a result of the impaired function?
Well, the signs and symptoms of an individual suffering from mild to moderate emphysema include dyspnea, meaning shortness of breath. You will see a cough with phlegm, which is why we call patients with emphysema a pink puffer. Patients will experience cyanosis when the lips and even the skin turns purple or blue due to tissue not getting enough oxygen. In more serious cases, patients will have even lower oxygen levels in their blood, which leads to worse cyanosis.
Are there a range of treatment options for emphysema?
Yeah, including medications, therapy and surgery. So emphysema is non-reversible, however there are treatment options available that can help reduce the symptoms and prevent further lung damage. Oxygen treatments are usually the first form of treatment. Pharmacological options include inhalers, steroids and also antibiotics. For people with severe emphysema, lung volume reduction surgery is undertaken to improve pulmonary function and the general quality of life of patients. A risk factor for emphysema includes the exposure to cigarette smoke. It leads to vascular damage and changes. Exposure to the smoke results in the activation of lung endothelial cells, which then leads to inflammation. This results in apoptosis and increased permeability of endothelial cells.
Would you be able to explain to our audience the diagnostic techniques for this condition?
If a patient has suspected emphysema, the diagnostic tests that will be undertaken include patient's medical history, arterial blood gas, a pulse oximeter, a lung test, a spirometry and a chest x-ray. The doctor will ask for the patient's medical history in order to determine if they smoke or have a family history in regards of emphysema. A pulse oximeter will be used by a doctor, which will then determine their blood gas saturation. The doctor can also listen to the lung sounds, which will be used in order to check for crackles and wheezing, which indicates an obstruction in the alveoli. And then a spirometry is also used to test for lung capacity. You'll see the results which show a decreased function in the form of a low lung capacity. Arterial blood gas tests are used to detect the amount of oxygen and carbon dioxide in the arteries, which will then show abnormalities in oxygen concentration, and a chest x-ray will clearly show the damage in the lungs.
Well, it looks like we're running out of time. Today we learned about how emphysema damages our alveoli. You also explained some of the signs and symptoms such as difficulty breathing and coughing, as well as treatment options like oxygen. Is there anything else you'd like to add?
Yeah, well, I think it's important to stress that the leading cause of this is smoking. Not smoking is the best way to prevent emphysema.
Well, you're absolutely right. Thank you, Dr. Smith, for being on the show.